what we've heard from providers over the years, and this is potentially providers that weren't excited about new modalities and just adjusting their practices and whatnot, but they were essentially saying, look, there's a lot of things you can't do over telehealth. But I would assume if we're running into roadblocks and we're not able to do the things we need to do over telehealth, that would be a huge dissatisfier. Are people experiencing that, or are they essentially saying, no, we're getting to resolution through these telehealth visits?
When you look at sort of the satisfaction on telehealth, you sort of have to compare and contrast the drivers of satisfaction with what is one of the major issues with telehealth. And so the top issue that consumers have in a telehealth consultation, again, it's not the technology, it's not the claim, the reimbursement aspect of it. It is really about the ability to understand the medical professional. And so if that's not achieved in the telehealth visit, there's significant declines in satisfaction. And so the more time you're able to spend with a provider and being able to get a close diagnosis to what your condition is, that is a huge driver of the overall satisfaction. We see this in other areas of healthcare that we measure. It's really around the authentic experience between the patient or the consumer and the practitioner of healthcare.
Do you get any indication as what drives the authentic experience? Certainly, if a telehealth provider is not good with people face to face, they're probably not good with them over a telehealth visit. All you've done is just change the medium. But are there certain factors in a telehealth visit that people said they made eye contact, they communicated clearly, clearly one of them was they spent quality time with me on the call. So are there other factors like that?
Yeah, fewer than 2/3 of the consumers we spoke to experienced a consultation that had courtesy, respect. They were listened to carefully. Things were explained carefully, and gave them the perception that there was value in the actual consultation. So these soft skills, we were not measuring them as hard as we thought we should have, and that's really being elevated. When we first started to conduct the study, we thought it would be about the technical requirements or the cost or the copay mechanisms. We're seeing this in a lot of our healthcare. It is around the authentic consultation between a provider, again, MD, PharmD, NP, PA, and the actual consumer is where there's a high degree of value.